We were approached by the Greater Manchester Social Care Partnership to help them design a public health intervention which was very much in line in supporting their alcohol strategy, focusing in on harm reduction but also around building resilience within the local community. We then worked collaboratively across Greater Manchester to pull together the design of communities in charge of alcohol.
We advertise within Bury Council. We advertise in there are voluntary organisations in the Greater Manchester area where you can actually register and put your advert on. Notice boards, health centres, speaking to different community groups. I think one of the other best methods of recruiting new alcohol health champions was speaking to the existing health champions and asking them could they recommend any friends, family or colleagues who may gain experience and would be good for the role. I think being there for them if they needed any particular support or issues, so we took them through the sort of council volunteer induction course for those that wanted it. We gave our volunteers the opportunity either to register with the council as council volunteers, or if they didn't want that, they could still have that arm's length support from ourselves as CICA volunteers. We've put them through things like part of the health trainer support, things like sleep, stop smoking, healthy eating, things like that. So give them a little bit more grounding into the wider detriments of health. I think there's two parts to it, but they are linked, giving people confidence and experience and the tools to go out and have those conversations in the community. But I think by design or default, the programme has actually, some of the volunteers that have been through the training have used it as a springboard, not only to volunteer and have those conversations with people in community settings, but met several of the people that we've recruited who haven't been in training, education or employment for some of them decades and hadn't done a training course and secured a qualification for some time. We've actually used it as a springboard to go into training, education and employment. So we've got some of the colleagues who, through their experience with the CICA and securing the RSPH Level 2 qualification, have actually used that now to go back into training, education and employment.
It's helped me to understand the needs of an alcoholic and understand from their point of view what they're going through. It's also given me a qualification, which is good. And it's also given me a lot more confidence because I'm having to go out and speak to the community, speak to the public, and it's helping me overcome my own anxiety issues and things. So it's given me a lot of confidence, understanding and knowledge.